Is there a disconnect in the medical community over boosters?
The fact is that truth is complicated, and there's still a lot we don't know about COVID. For one thing, if you have an immune suppressing condition, you're on high dose steroids, you have an organ transplant, you have certain medical conditions, there's already broad consensus that you should get a third dose of the vaccine. That's not a booster, that's a third dose. What we really don't know yet is, does immunity wane, or is Delta just a more vigorous virus that's harder for the vaccine to control? And in either case, it's likely that people over the age of 65 or who are medically vulnerable may need a third dose to be adequately protected. But it's unfortunate that we haven't scaled up manufacturing of vaccines globally, because there are too many people all over the world who don't have access to even a first effective dose of a vaccine.
The Biden administration recently ordered companies with more than 100 employees to require vaccinations or weekly testing. What's the history or past precedent of requiring vaccinations in the U.S.?
We do require vaccinations. Every state requires measles and other vaccinations for kids to go to school. Many nursing homes require their workers to get a flu vaccination because when they do, it's less likely that residents of those nursing homes will die during that flu season. So vaccine mandates are a well-established way of protecting people. I think there's one thing we have to understand. This isn't just about you. When you're not vaccinated, you might ultimately spread the infection and result in death, whether it's in a relative, a grandparent, the checkout person at the supermarket, a healthcare worker, and not just from COVID. But if you require care in the hospital and other people can't get care, whether it's for a burst appendix or for a heart attack, that also has an effect on others. We like to think that we have total say in what we do, but sometimes what you do affects whether other people can live their lives.
Here's a big question. Do you think, in your opinion, are we nearing the end of the Delta surge, or do you anticipate a winter surge?
It's really hard to make predictions, especially about the future. And the fact is, we are seeing a cresting of cases. They're coming down, but we don't know what the future is going to hold. What I say about COVID is, beyond 3 or 4 weeks from now, it's a pure guess. And I'd rather not guess. What I'd rather do is make sure that we have everything in place so that we minimize the disruption to our economy, our jobs, our learning, and we minimize the loss of life. And we can do that by vaccinating, masking up, increasing ventilation, increasing testing, and support for people who test positive.
You were head of the CDC during the Ebola outbreak in 2014 when the U.S. saw its first case in the country. Now, as someone who has handled infectious disease response for the U.S., how difficult is it to prevent and then eradicate an infectious disease? And what would the world be doing now? What should the world be doing now to prevent future outbreaks?
We're all connected. We're all at risk. A disease that emerges somewhere in the world that isn't found and stopped can affect us within a day or two. That's why we've recommended that every country, everywhere in the world, should be able to find every new health threat within 7 days of when it emerges, report it, investigate it, begin control within 1 day, and implement defined control measures within 7 days as well, what we call the 7-1-7 target. If the world did that, we would be much safer. In order for that to happen, we're going to have to invest in public health. We're going to have to reduce the risk of accidents where pathogens can be released from a laboratory. We're going to have to reduce the risk that wild animals are captured for food or other reasons and result in the spread of infections to people. And we're going to have to better understand our relationship with nature, particularly organisms or like bats that have a lot of infections that can spread to people if we don't control that what's called human-animal interface better. But fundamentally, what we can do as people is make sure that there's systems all over the world to find outbreaks when they first emerge, stop them quickly, and prevent them wherever it is possible. And you mentioned disease eradication. I want to just recall that the world has eradicated smallpox, and that has saved hundreds of millions of lives. Disease eradication isn't possible for all microbes. It's not possible for COVID at this time. But eradication is the ultimate in both fairness and efficiency because it's forever and for everybody.
Dr. Frieden, thank you so much. We really appreciate your insights.
It's a pleasure speaking with you. Thank you so much for doing it.
Thank you so much.
We really enjoyed this ASP chat. Be well, please.